Okay. Good evening and welcome to the Conversation 360 on COVID-19 and disability. I'm Melanie Cawthon with Disability SA, and I'm joined tonight by our partners in the survey that we'll be reporting on, Jane Passioni with the Successfully Aging and Living in San Antonio Collective Impact at the San Antonio Area Foundation, and Deborah Sharvin with the Disability Access Office for the City of San Antonio. And tonight we will be presenting the findings of the survey that we conducted back in September on gathering the experiences of individuals with disabilities during COVID-19. We had about 425 responses, and we found a lot of information about where people with disabilities were struggling. And I'm going to turn it over to Jane and Deborah to report out the information that we were able to collect through that survey.
All right, welcome everyone. Thank you for having me, Melanie, and everyone with a Disability SA. As you heard from Melanie, this was a survey that our three organizations decided to get together to figure out exactly what was going on in our communities related to COVID-19. And so we were hearing a lot of different issues and challenges, especially as the pandemic started last spring and early summer. And so we released this survey in August of 2020. And so what we're going to go through tonight is we're really just going to go through our findings pretty quickly because we want to make sure that we're cognizant of our time. So if you have any questions, please feel free to enter them in the chat. We have some time before the breakout sessions. We will answer them. If not, we will answer them at the end of the evening, kind of in that reflective and input section after the second breakout ends. And so, as Melanie said, we had over 400 responses to this survey. And we were very excited, at least I was, because we really did have more people who were living with a disability answer this survey. And for those of you who may work in this profession, you understand that sometimes that's not what we get. We get the caregivers, we get the residents, we get the organizations, but sometimes it's very hard and very difficult to actually connect with the voices of the people living with disabilities. But we did have a preponderance, over 50% of our respondents were people living with disabilities and going through the experience of COVID-19. So we were very confident in kind of our responses and the experiences that we were hearing from. We also obviously had caregivers of those who were living with disabilities. We had some different disability professionals or organizations answer. We also just had residents who were interested in this subject and wanted to share their thoughts. And then we had a small proportion, about 3%, who did not self-identify as any of the categories we listed. So one of the questions that we really wanted to know was exactly how people were getting their information. So we could start really looking at how we could target messages related to different information, different resources. And what we found was really exactly what we thought was that most people who answered the survey were getting their information from internet sources, which could be various agencies. Television was the second largest source. Government agencies, which is what I fall under, was a third source, and then family, friends, radio, and the different organizations that they trust in their life kind of ended up being kind of in that top category. And so this tells us that while sometimes digital divide issues, digital inclusion issues may preclude that information coming from the internet, we still had a preponderance of people who got their information from that. So we cannot leave out the digital conversation as we look at messaging as we move forward. And then we look at that, how we can do better in accessing television to really get out some important messages as we move forward. So the big kind of meat of our discussion and what we really got out of this survey was, where were people impacts of COVID-19 and everything that was happening. I know it feels like a million years ago and it feels like just yesterday, but when we did this survey in late summer, we were still pretty much, for the most part, closed. We hadn't opened up businesses yet. We had gone through different variations of lockdown where people were pretty much at home. Access to services were tough, and organizations and businesses were still struggling to figure out kind of how they could serve the public in doing what they needed to do. And so the biggest impact when you look at this dark blue line really represents people living with a disability. And really, if you look at their overall impact, social experiences was the top one. Then came food access or food security, and then came healthcare access and healthcare issues. And those are really the top three concerns for people living with disabilities during the early stages of this COVID pandemic. When you look at caregivers also listed social experiences as number one, but they moved to healthcare, and then food was a lower access or a lower concern for them, or a lower impact for them. We also have organizations and concerned residents, social experiences just were overall really where impacts really were felt, and then healthcare, and then food access. And so it was, to me, it was really interesting that for the most part, all of these different identities had similar responses about where impacts were felt. When you actually look at one of our questions was exactly where was going to be their concern moving forward in the future. And the top concerns moving forward, it really is very stark when you look at this chart about where the differences were based on your identity. And so even though social experiences might have been one of the top concerns for people living with disabilities, as they were experiencing COVID in that moment, really it was kind of personal and family health that really became their most important concern and issue moving forward, and what they really needed to what they worried about basically. And again, remember that this survey was done before we had the vaccine. The vaccine was still coming. Nobody quite knew timelines. And so it makes perfect sense that this would be a top concern. However, when you look at concerned residents who may or may not have anyone with a disability in their life, but are very interested in this conversation, they overwhelmingly pick social experiences as their future concern on how we can ensure that people with disabilities were included and having those experiences and those level of touches. And then again, one of the things that I want to point out is the differences between the different identities. And so we have food security or food access as a main point that was a future concern across the board. But look at the difference. People with disability had about 25% of the respondents living with a disability said food access and food security was definitely an issue point, a future concern for them over time. But yet caregivers, it was about 11%. And so to me, it's very interesting as we move forward, kind of how the different groups were looking at this and looking at the concerns. And honestly, as we go through and we looked at different national surveys that were being done by the National Disability Institute, by NCPAD, which is the National Association on Health and Physical Activity and Disability, these concerns fall right in line with other communities around the country or national surveys that have national organizational components to them. So we feel very confident that the disability experience is pretty similar no matter where you were. And so it really becomes kind of disability related into what you're really feeling and experiencing during COVID.
Not everyone that has a disability has a caregiver.
You're right. And that is true. And so the ones more than likely these are going to be family members versus, potentially they could be a paid personal care assistant. It really just depends. We didn't ask when we did ask people to self-identify as part of the survey to distinguish whether it was a family member or a paid caregiver. And you're right, people living with disabilities do not always have anyone there as a caregiver or as a family support system. I think that's a myth, that a person with a disability is always living with someone else or someone else's caregiving. And I think that's a stereotype and a myth that we need to break as we go forward. And hopefully some of this data will help us do that. So one of the other things that we asked was an open-ended question. And it was really, what are your suggestions? If you have these concerns, you have these challenges as we're moving forward, what are you suggesting? What do you think we need to do? And again, remember kind of the time and place of this survey. Vaccines were a long way away. We were still kind of in the, everybody needs to mask up conversations and things like that. And overwhelmingly, where the majority of responses and solutions came to was really to follow public health guidelines. They were very much, our survey was respondents very much on the side of there are health guidelines for a reason. It saves lives. Do it. It very much that conversation. Obviously, there was definitely some conversation around vaccine and testing for coronavirus as this went through. They also focused on how we could provide different safety nets and focus on individuals living with disabilities to help with those safety nets. So we had a lot of conversation and solutions around how do you get assistance to the vulnerable and the marginalized communities, including people with disabilities, when it is harder in some instances to get access to services, particularly if you do not drive or do not have access to personal transportation. How did that affect getting access to services? How could they get food? And how did they get and transition to these online services? When everybody basically shut down in the physical world, how did they get themselves transitioned to the online world if maybe they didn't have access to either maybe a computer or did not have internet service on a regular basis, which I know is going to be one of our breakout rooms as we move forward tonight. A lot of the other suggestions focused on what we considered quality of life solutions. And so we had a lot of conversation in the solutions regarding education and schooling issues. I think you guys have heard a lot of the conversation about how online learning affected different youth and students with disabilities, whether they were college level or in high school or elementary. And then how can you get them retrained and provide the job opportunities as the economy basically was crashing and burning? And so how do you develop those workforce? How do you get them safe socialization opportunities? And how do you do all of this was making sure that the barriers for communication, all of these mental health issues that were swirling around during this pandemic, how do you take into account all of these different pieces of information? So these are really the solutions that were by the survey. And so, so really we kind of looked at all of this data, and we really kind of came up with these very kind of what I call quick and easy. I say they're quick and easy, but they're really not when you really get down to it. But how we're going to move forward in this process, which is really how do we take this data? How do we move it forward? And really, I think it just confirms that programs and services, regardless of who the agency is, regardless of who is actually providing the service, must be person-centered, and it must have targeted and intentional inclusion of people with disabilities. And that could be making sure, like for example, the city of San Antonio, as we're doing vaccine rollouts, how do we really work and get the vaccine to people who may not have access to personal transportation? I know, for example, we worked with FIA to make sure that paratransit would be able to drive people to vaccine appointments, things like that. That's one of those conversations that we had, that we were very intentional in making sure we really were targeting some of the groups that we know we're going to have access issues. I really think that we also know, again, these types of programs and services need to be very inclusive. Not only do people living with disabilities need to be at the table, part of the planning, part of the implementation, part of what I call the evaluation cycle, we need to make sure that we're looking at all of the whole person. One of the things that came out of this survey was, statistically, when you look at all of the actual data, we can only have statistically valid numbers when you relate to people who were identifying as white and people who are identifying as Latinx or Hispanic. And we could not say, while we did have people who responded to the survey who identified as African American or Asian or Indigenous, they were in such a small number that I know, as someone who is giving the survey, I need to look at how we can be more inclusive in the future to make sure that we are including everyone and the whole spectrum of people living with disabilities in our community, regardless of race, regardless of ethnicity, regardless of gender identity, regardless of religion, to make sure that we're getting and we are culturally competent as we're building these programs and services and we move forward. And the last thing that I think that we are really recommending that programs and services be is empowering. And I think that that is that whole conversation again, that people with disabilities need to be part of the conversation, part of the development of the plan, and part of the solution. And it's just not a part of the community that we are serving or providing services for, but we really need to start seeing the disability community for the skills and knowledge set that they bring to the table. And so I know I kind of talked a lot, and I also know that I went very quickly. So I don't know, Jane, if you have any comments or thoughts to kind of add through this process.
I think you did a really good job of going through these slides in a timely manner to get this information out. But just like Debbie said, we, people with disabilities, need to be a part of the solution. We've got to be a part of the planning, and we have to have that expectation that we will get an invite. So this survey was at times heart-rending, because there was a lot of fear out of there. And I just know, as a community, as a person with a disability, we can do better. And that's what this conversation about is tonight. What can we do as people with disabilities? What can service providers do? Nonprofits, what can they do to help us with this? So thanks, Debbie. You did a great presentation.
Yeah. So like I said, it was very short and sweet because of the condensed time that we have. But if you'd like the full survey report, we've got a short infographic, an executive summary, and a very extensive kind of a long version of all the survey data that can be found at the City of San Antonio's COVID-19 portal at covid19.sanantonio.gov. It'd be found in the plan and report section. Or if you want a more direct access to it, you're always welcome to contact us at the Disability Access Office at 210-207-7135, or you can email us at disabilityaccess@sanantonio.gov. We'll be able to get you to all of that information. Or if you're even the data nerd and you want all of the raw data, we have access to that and can share that with those of you who really are scientists in the group and really kind of want to, what I call nerd out with me. And so I just want to say thank you for the time, and we'll make sure that this is shared with you kind of at a later date case. But Melanie, are you ready to kind of take it back?
Sure, if you'll go to the next slide.
There you go.
We have 7 breakout rooms for you this evening. I'm going to start moving and if my room rotators will start moving our volunteers and facilitators into their rooms, then individuals who are here as attendants, you'll have 2 rotations. One from 6:30 to 7 o'clock and the other from 7:05 to 7:35. And we'll come back into this room for a little bit of reflection afterwards. So if you can self-navigate to your first room, or if you would like, you can put the room you would like to go to in the chat, and our room announcer will let our room rotators know where you would like to go. So again, you can self-navigate to the room of your choice. We have shelter and housing, digital access and socialization, transportation, vaccine and healthcare, food scarcity, education, and employment. And we'll be recording each of these sessions. So if you don't get into a session, if there's more than 2 that you would like to participate in, we will be recording the information that's presented in each of the rooms. So you won't miss out on anything. If you'll just put in the chat where you would like us to rotate you to begin with, we can make that happen for you. Anna, if you would like to take the interpreters into room number 1 for the first part, and then you'll be in room number 4 for the second. Okay, with that, Dale, what room would you like to go into? Or are there things in the chat that were, okay. And Tina, if you'll unmute and just read out the chat for us. Scroll back up to, let's see, Sandra's food insecurity, 5.
I don't see any chat messages. Maybe people are just messaging you individually.
Oh, great. Yes, they are. I see that. Okay, so are y'all able to do everyone?
Yes, they should be able to by pressing
Okay.
to, there's a drop down arrow. You should be able to click everyone.
All right. I'm gonna go through these slowly. Hold on. Okay.
Or Melanie, do you just want to read them out to us?
Pilar wants digital access.
It only give us access to send messages to direct people, not to everyone. Yeah, I would like to go to digital access.
Okay.
Angela, food scarcity. Ryan, room number 2. Pamela, room number 1. And that's all that's in the chat right now. So Jonathan, where would you like to go? Lewis? Todd?
Either employment or digital access, please.
And Dale?
Number 4.
And that just leaves us here. Okay. Natalia, if you will go into each room and just let them know, even if they don't have anybody in this first session, to go ahead and either do their presentations or respond to the Kickstarter questions.
Do we want to just send that in a broadcast message? I feel like that might take less time.
That would take less time. It does take, okay,
Like,
so
it might
broadcast.
go to everyone. It'll be like 10 minutes by the time we get
It
back.
will be.
Are you okay if I stop sharing the screen, Melanie?
Yes. Yes.
I just
I
wanted to
will-
make sure.
I will put it up later when we do the, oh, what happened to my message?
Did I take it off? Because I was
No,
sharing?
okay, go ahead and start your conversations. Please remember to record. Even if there are no guests, do your presentations of information and respond.
And then if you want to stop recording this session, maybe if you want. It's going to be a lot of nothing.
Thank you.
No problem.
The beginning of the discussion tonight, and our work here is not done. We have a lot of work to do to move our community forward to a place where the issues that people with disabilities saw increased impact over and above the rest of the general population during the pandemic need to be addressed, and solutions and progress need to be made. And so we'd like to conclude tonight with everybody just feel free to take your, unmute yourself and add to the conversation of if you wanted our community leaders to hear one thing about your experience as part of the disability community during COVID-19